This chapter covers integumentary or skin diseases and disorders. Diagnosis for acne is usually from uh, just viewing the lesions. Um, More common treatment may be antibiotics. Typically, you have to be concerned about some bacteria involved, so they'll use that to help to clear the lesions. They may also use a longer term antibiotic to kind of suppress the problem. Prognosis depends on how involved the acne is, how severely it affects the skin, and by how compliant the patient is in the treatment. Um, you may have to show them in some cases how to use the different types of treatments that are available. Uh, and of course, um, something that a lot of people do is one that you don't want them to do, and that's kind of squeeze on any pimple or pustule involved, because that only it allows the potential introduction of bacteria. Um, Other things that might be used are keratolytic agents, um, and one chemically related to a vitamin A or benzoyl peroxide gel. These are the more common ones. This is just kind of keeping them clean and then keeping them dry and trying to suppress the lesion somewhat. Diagnosis for acne is usually from uh, just viewing the lesions. Um, More common treatment may be antibiotics. Typically, you have to be concerned about some bacteria involved, so they'll use that to help to clear the lesions. They may also use a longer term antibiotic to kind of suppress the problem. Prognosis depends on how involved the acne is, how severely it affects the skin, and by how compliant the patient is in the treatment. Um, you may have to show them in some cases how to use the different types of treatments that are available. Uh, and of course, um, something that a lot of people do is one that you don't want them to do, and that's kind of squeeze on any pimple or pustule involved, because that only it allows the potential introduction of bacteria. Um, Other things that might be used are keratolytic agents, um, and one chemically related to a vitamin A or benzoyl peroxide gel. These are the more common ones. This is just kind of keeping them clean and then keeping them dry and trying to suppress the lesion somewhat. Herpes zoster, more commonly called shingles, is an inflammatory um, effect to what's called the dermatome specifically, so that's a key word. The eruption in vesicles. Incubation period is from 7 to 21 days, and that's the time. Incubation period is the time between when they have been exposed and then when they develop symptoms. Usually it lasts 10 days to 5 weeks, um, with the lesions showing up in the first couple of days of that. They usually will have pain over the nerve pathway. Um, Usually there's a band like along the nerves from the dermatome. Um, 2 to 3 days, pain starts about 2 to 3 days before the lesions appear. And I've known a number of people who've had shingles that say they never noticed a difference, but it may be that in some patients it's so low level that they don't. They start out as looking like a rash that then develops into vesicles. Um, then the skin um, above the dermatome gets reddened and blisters. With shingles, sometimes it will remain dormant for a long time period. It's still there in the root ganglia of the nerve, um, but then for whatever reason it reactivates maybe years later, and they have then a case of shingles. Usually it's diagnosed by the pattern that the lesions appear in. It typically will follow a nerve pathway, um, but you can also do um, cultures of the vesicles and also determine that way. Usually, most of the time, it's gone away within a month. Um, but some patients may have actually some pain, some neuralgia pain long term from it. And of course, we know there is a vaccine. It's called Zostavax, available. Um, it's a fairly new vaccine. The all of the potential benefit or effect of it isn't 100% known yet. Um, Usually, treatment is things like analgesics, making them feel better, mild tranquilizer, sedatives. If you have people who have been forced to do vaccines at times, especially as an adult, they may choose. That's a choice. That's an option. They may choose to do it. They may not choose to do it. Um, but other than that, it's trying to make them comfortable, giving them something for pain. Usually, they start with mild. Um, they may have to have a sedative to sleep. They may have to have something for itching. Um, they may give them a steroid. They may give them something to dry them up, or give them a prescription to dry up the lesions. And then they may do a lidocaine nerve block if it's really extreme. In order to determine the type of impetigo that's involved, there's two tests that may be done. One is the Tansic test, and one is the Graham stain. Prognosis is good with this. Um, they One of the recommendations is always good hand washing, and that's just as a line of defense. Usually, you see this caused by Streptococcus or Staphylococcus aureus. Those are bacterias. It starts with an insect bite, for instance, or scabies infestation, poor hygiene, anemia, or some other type of physical problem, malnutrition, something where the skin is maybe not intact. Treatment is antibiotics and keeping the lesions cleaned at least 2 or 3 times a day and letting them dry. They start out as just inflamed hair follicles that get infected, um, and get swollen and painful, and then enlarge and drain pus. And again, the carbuncles are much more unlikely that you would develop those. People who are more likely to develop these are people who have things like um, diabetes mellitus, nephritis, if they have a immunodeficiency problem. Um, those are all higher risk groups of patients, mainly because their tissue in their body is more fragile to begin with. The most common cause of them are Staphylococcus aureus or Staphylococcus, one of the Staphylococcus species, and so that could be a number again there as to what causes it. But it all typically falls in the Staphylococcus bacteria type family. Treatment is apply hot compresses every few hours. Um, that helps to make it more comfortable, but it also helps it to drain faster. And in this case, you actually want these to drain. Um, they may have to have antibiotics for a long time period. Cellulitis is more an acute type problem. It usually starts as bacterial infection, from the skin and subcutaneous tissue. Most common causes a streptococcus or staphylococcus bacteria getting in through some kind of a small break or puncture in the skin. If it gets the lymph nodes involved, then they may have more systemic type symptoms like fever and feel bad and all that. Um, if it they have it where they have it kind of looks swollen, it's red, but then it starts showing some red streaking from the sides. That becomes more of an urgent type of need for treatment, or you need to be seen. Um, Usually, they'll have redness, erythema. They'll have edema that uh, you can visually see. But if you kind of put your thumb in this tissue, just kind of press a little bit, it would leave an indentation when you removed it. The skin is tender. It usually is swollen looking. It's warm to the touch and usually pretty distinctively warm. Um, uh, the red lines and streakings may be more of a infection base there. So this is something that can be begin as mild and very treatable, but may also get a little more significant in its um, in the need to be a more quicker treatment because it can get much more involved. Treatment with things like aspirin, anti-inflammatories, the NSAIDs, maybe some Tylenol, and they may also, go to the point of if it's really uncomfortable, do Tylenol with codeine, for instance. If it is very severe, they may actually have to be hospitalized. In caring for it, hand washing is really important, um, and also in prevention little small nicks and cuts. This is a lot of times where it arises from, so you want to make sure to try to keep infection from getting involved with those kind of areas. If it's not uncommonly, you'll see it on the leg, so we will want to elevate that leg and immobilize it. Um, Use some cool magnesium sulfate compresses. Um, and that's for more comfort measures and warm compresses to increase the circulation. Um, and then systemic antibiotics, so it's going to be oral or injectable antibiotics typically.